Good morning, good afternoon, good evening. Whatever time it is when you're watching this, I'm delighted to connect with you. I'm Evonne Miller. I'm Professor of Design Psychology and Director of the QUT Design Lab, and also Co-Director of HEAL, the Healthcare Excellence AcceLerator, which has put designers, design thinking and design doing into hospitals across our state. What I'd like to do with you now over the next 20 to 30 minutes is walk through the fourth module of our modules on design thinking. And this module is focused very much on prototyping and testing. The last few modules have really just walked us through design thinking process and how you can use that when you're tackling some kind of work challenge or problem or opportunity. And it's really important to realize that the design process is not linear, even though we have been telling you these kind of steps that you can follow, starting with empathy, defining and ideating, and now prototyping and testing. These steps can be used at all different stages, okay? So you can jump forwards and backs and roundabout. However, when you're running a design thinking workshop, these are generally the steps that you will follow and the order that you will follow. Oh, I'm just going to move my own picture so you can see the heading. Apologies, there we are. So as I said, the focus is on prototyping. Prototyping is another creativity technique and a critical step in the design thinking process. Prototypes are physical models of ideas, and they should be easy and quick and cheap to create. Prototypes are action-orientated. They're driven by a central design question. What can be learned from this model? How can it be changed or improved? What other ideas does it spark? How can we think differently? And in this design process, prototypes are essential for early and iterative concept development by the design team, with clients, and of course, potential users. The focus on direct user interaction and feedback. And in an ideal world, the prototypes will be tested by real users so they can identify the basic or functional requirements of the proposed solution. Good prototypes are provocations. They help us think about what might be, and they simulate conversations and feedback about the relative importance, desirability, the practicality of different features. Prototypes are designed to spark ideas and to be altered and to be changed. And that's why, in most cases, we want the level of detail in a prototype, what is called the fidelity, to be low. Low fidelity prototypes, lo-fi prototypes, are made from sticky notes, from basic cardboard materials, from sketches and storyboards. And they're perfect for that kind of high-level brainstorming and for developing, refining, and changing ideas. So that's why in the design thinking workshops that we're mostly talking about, we're using lo-fi prototypes. High fidelity prototypes, on the other hand, represent the more final look, feel, and basic functionality of a product. And whether you want to develop a product, a service, a physical space, a system, a process, or a website, you can and should use a prototype during the development of the idea. Prototypes really are about making ideas tangible, about showing, not telling, your concepts. Here are some examples of prototypes from a few different projects we've done. So the top left and bottom left are an example developed by Clinical Excellence Queensland Fellows, actually, to talk about how we need to better connect and better serve remote and rural areas of Australia. On top right, we can see an image of a building. That's how we might redesign this space to be more biophilic, that is connected to nature. Bottom right is visions of future in terms of integrated and connected care. So you can see that there are pictures about what consumers want. They want care to come to them virtually, and they can access care and use technology. They're confident, and their healthcare professionals talk to each other and to themselves, to each other and to the person. And then the middle one is an example from a project with Queensland Children's Hospital. We actually looked at how to, during their Big Ideas Week, how to redesign meetings. You know, how can we create meetings that really work, that are more efficient? And we actually used Harry Potter as the theme, and people were grouped into different, houses, and then voted on the winning ideas. So you can see, I think, that these are all kind of really good examples of low fidelity prototypes, but they're quite impactful. And when you're thinking about prototypes, my personal recommendation would be just to do something quite simple, to give people some materials, some cardboard, some drawing, some highlighters, pens and paper. But you can also potentially use tools. So I've got a tool here. This is from a wonderful resource, Design Thinking Toolbox, and I've got a website. You can see that down at the bottom. And this handout enables you to think through and to write through your thoughts about your prototype. So what ideas have you suggested? Why we're using this? How can we make this possible for the user to interact with? And then what kind of different prototypes they are. So you can see there's multiple options, because the whole idea behind a prototype is to test, to think differently and test. Now, as I said, we are predominantly going to be talking about low fidelity prototyping, but you can get more, I guess, high fidelity prototyping. It's not just the kind of simple cardboard and paper that we'll mostly be focusing on. And my colleague, industrial designer Marla Chomak-Cock, led a couple of projects during HEAL that did more advanced prototyping. One looked at mannequins and how we might be able to manufacture these at a lower cost to make it more accessible to local community groups, and also manufacture that locally. And she looked at two specific examples. One is a child-size interactive mannequin to teach children how to do CPR on children. And the other, which is really quite interesting, is a female mannequin with breasts, because the feedback we got was that actually often people don't know, consumers I'm talking about, don't necessarily know how, or are not as confident to give CPR to women because of breasts. And so this mannequin represents 50% of our population. Marnella and colleagues also led a child-friendly PPE, personal protective equipment process, looking at redesigning it so that the masks were not as scary for children, essentially. And you can see some of these early prototypes here. This also involved workshops with children who got to design and draw and share their own ideas for prototyping. And it resulted in two prototypes that are currently being tested. You can see the one on the left-hand side, Buddy, has these kind of clip-on face shields that you can change with different emotions. And the one on the right-hand side, Sunny, has a halo light to light up eyes. So these are examples of prototypes that have been developed and tested here in Queensland and help us think differently about solving problems. We also looked at, and if you look closely here, you can see the images of how can we create more comfortable PPE. Where are the pain points, and how can we redesign that? So we led a conversation about that and working on some guidelines at the moment. When it comes to prototyping in a design thinking workshop, though, in general, it's well and truly enough to provide paper, pens, maybe some pictures, cardboard, maybe some coffee cups so people can assemble things, and some bits of wire and just any kind of resources you've got lying around. You create a little design thinking kit, you can leave it on the table, and that gives people something that they can use to create a model of their idea. And I'm going to talk through some of the examples that we've used and you might want to use in your own practice, or at least think about integrating that as you think about, okay, how can I use a design thinking approach in my workplace? One of the examples we did in here was with Westmoreton and connecting to rehab services, Ipswich and Boona. And we held like a day workshop among other things. And you can see, I don't know, I feel like I should have brought chairs and 3M or something, but basically you do use a lot of Post-its in design thinking workshops. And here we ask people to think about, what are the challenges and opportunities from the perspective of technology, family, patient, and space. And then to list those and then for people to vote on their favorites with sticky dots. But we started, and this is a good example of how you can encourage creativity. We started the event by asking people to sketch a moment of exceptional practice, a moment they felt that they went over beyond, their normal clinical role. And you can see here on the right-hand side, one participant sketched a picture of how they had a person who had a stroke, they were at home and they were in the rehab ward for quite a while and they were missing their dog. So they brought the dog into hospital. Another example was just literally when somebody's lost in the hospital, you actually volunteer and say, hey, how can I help you? We have more examples here about when people are stroke patients unable to move, now they're walking, Christmas on the ward, the first trip home after 18 months of rehab, and at the top again, standing for the first time. And these are quite powerful ways to communicate ideas, and it can be a really good, this kind of drawing can be a really great example, really great icebreaker. You can also use this for storyboarding, and a storyboard could actually be your prototype outcome if that's what you want to do. So this is again the example of Ipswich, and they're talking about, okay, you start at home, you have an accident, where do you go, and what are the key moments in the element drawn in comic-like form through a storyboard. We pin that up on the, at the workshop on the wall, and then we've asked people to add in little comments or add a scene. So we've had a real conversation about what the idea is that they're sharing and how could that be changed or improved. And if you can see on the left-hand side, someone's added the scene that said, I don't want treatment at hospital, leave me at home. And another one responding to the scene in the ICU, listen to me. Quite powerful, really, I think. That was an example of a low fidelity storyboard. Here's an example of a high fidelity storyboard, much more resolved and professional looking. One of the projects we used was to develop animations and a brief animation about cultural safety. But to develop that, we co-designed with clinicians and First Nations consumers the storyboard, the narrative of what we would do and what we would say in this animation. And so this is an example from the animator, develop full feedback about the scenes and what would be said. So this is more kind of a resolved example of a storyboard. But I think you can see that both are powerful and both can be used in prototyping. You can, if you wish, if you want to tell a story for your prototyping, you can use freely available resources. And this is an example of one. It's a storytelling canvas where you write about what's the story about, what does your audience think, feel, and know beforehand, what do you need to introduce, what's the aha moment, what's the end of the story, and how have things changed. So when people are pitching back, the outcome of your co-design or design thinking workshop, it might be like a physical prototype or it might be a narrative. And you could give them a tool like this where they could actually write through and develop their script or their scene or what they're going to say is going to change as a result of their idea or concept. Prototyping can also be a role play where participants might play a specific role to see concepts, ideas, or propositions from different perspectives. So you might be looking at, I don't know, remote patient monitoring and looking at how that works from the patient perspective, from their carer perspective, from the GP perspective, from the hospital. And you could actually create a little skit or a little play, just relatively short, and actually role play out your intervention or your idea for change. This can be really memorable and quite fun, but of course it does require the right personalities. I quite like to use this approach that my colleague, landscape architect, Deb Cushing and I coined a few years ago now. We wrote a book called Creating Great Places that talks about different theories designers should use in their practice. And we wanted to make the process of engaging with theory, we wanted to make that more fun and enjoyable. So we came up with this notion that we called theory storming. Now, this is inspired by Edward de Bono's 6 thinking hats. Now, in the 6 thinking hats, if you're not aware with this, you can say in a meeting, look, I want us to put on a thinking hat. I'm going to put on the black hat and just be critical. Or I want to put on the yellow hat of being positive. I'm going to put on the white hat of just the facts. I'm going to put on the green hat of creativity and so forth. And what we have said in our theory storming is that we want people to explicitly put on a hat of a different theory or a different perspective and be the voice of that theory. So for instance, we might say, okay, I want you to put on you're sitting around the table, you've got 6 participants in your design thinking or co-design workshop, and you might say, right, for this aspect where we're redesigning, you know, the entrance to the hospital or how the ED works and flows, I want you, Natalie, to put on the hat of biopic design and you be the voice of designing with nature in mind. Or I want you to put on the hat of personal space theory and think about, okay, what design decisions do we make to respect people's need for personal space? And we called that theory storming. We've used that in a number of different settings, and it helps people step out of themselves and be the voice of a different perspective. So you can see this example here with a Queensland department. We asked people to put on, you know, and literally wear a party hat that of sustainable design or biopic design or playable design. And also some people with a voice of specific user groups. So someone had the hat on of a homeless person, of a single parent, of an older person, and they had to make sure that that person's perspective was present in the, you know, in the conversation and in assessing the prototype and in communicating that to the group. And this is some examples of the outcomes here, which you can see. I think this is about redesigning a place to be health promoting, and they've got fun things like bus stop swings and a number of different ideas. A critical part of the prototype, it's just, you know, we're at the end of the design thinking session, is the pitch. Okay, you kind of come in together, how well your design thinking session, so how well it works, and if people walk away thinking, yes, that was brilliant and they got a lot out of it, really does often end on the pitch and how well different ideas are communicated. So support people to develop something that's kind of fun and engaging, and that might be, you know, that might be a skit, which is what we saw in the top left there. It's we have a dream, and then they actually did a mini play outlining their change. It might be a drawn out sketch, or it might be just a number of different ideas put together. And I guess as well as trying to encourage people to be engaging and provocative, have a timer, okay? People, you know, they want to talk for quite a while, and if you want to keep your design thinking session on track, you need to set a physical timer on your phone that goes off and give them, you know, a minute to present, and then take questions. But the pitch is really, really important. After the pitch, I would normally have people vote on the winner. We're coming to the end of a design thinking workshop, and we've got to decide as a group what our top ideas are. And there's a number of ways to make that more, I guess, engaging or fun. Lately, I've been using play money. Give each table gets a certain amount, and so they can pretend to be an HHS, sort of making real decisions about investments. I've given, you know, you can say it's like $2,000, or actually it means, you know, this represents $2 million, and they can decide to give all their money to one idea or just part of their money. And so that makes everything kind of really truthful, I guess, or quite real. And so you would pin up the prototypes or the, you know, on the walls or on the tables, and then get everybody to go around and decide either as a group. So often I'll get them to decide as a group, so they have to come to a consensus. Or sometimes you might say, right, everyone's got 3 dots. You can go put your dots wherever you like. Or if it can be, sometimes it can add up, getting all these equipment. So you can just say, okay, please go tick 3 times. You've got 3 ticks. I particularly like to try and make these things as fun as possible. So I have, see, the participant here she was the winner, and that actually, the hat says Design Visionary. And so and we make a hat for the winning team, and they have to wear it with a photograph. And it just makes it a little more playful. But behind you, I just want to draw attention to behind her. This is ideas that people, this was a workshop on how to design out procedural pain. And there were a number of ideas. Groups put them up individually. Then again, they were given their stickers to put in about what they think were most important and most significant. And as a cohort or as a facilitator of the workshop, you need to capture that feedback. You know, there's no point running a workshop and then actually not doing anything with the information. Okay, so the whole idea, you've got this cohort of people together that put aside this time to be with you, for you to facilitate them through this process. You need to make sure that you give them a written report or a summary or some really solid steps moving forward. And it might even be, these are all the barriers that are identified. These are the priorities or what's happening. And you can capture feedback in many ways, but simply doing things like, butcher's paper on the wall and some dots and dot voting is really simple and impactful. You can also think about using existing tools, okay, online. So this is an example again from the Design Thinking Toolbook. And this, you can hand this out and ask people to come up with different ideas that are kind of getting people to stretch, where they're at. So you could say, radio, how innovative is that? Is it in our comfort zone? Is it in our stretch zone or our risk zone? And really, write down and adjust where you want to go and how things, I guess the risk appetite for your organization. And of course, finally, it's important to prototype, and then of course you must test your prototype. Take it out to your user groups, get that feedback. It's always iterative. You go through all those stages and you prototype it, you test it, you assess it, you take the feedback, you improve it. You might, there's a number of different ways you can assess things. You might ask for, a formal feedback form, and we've got some examples in our resource kit. You might ask for like, I like, I wish, I wonder as feedback. But it's really important that you get that feedback at this as early as possible so that you can change the prototype and adjust it to as much impact as possible. As you think about, what we've just learned, it's kind of very much a rapid tour through, prototyping and design thinking. Think about, what prototyping tools would you supply? Like, do you want to just give people pen and paper and that's fine? Or do you want to cut up images? Or are you really thinking you want to use like pipe cleaners and coffee cups and give them some real cardboard boxes? Like, what kind of outcomes, what kind of prototype do you want the outcome to be? You could draw up a storyboard for your situation or mock up your own prototype of your own idea. Those are some kind of activities that you could do. And I guess in closing, I really believe that by working together collaboratively, designers plus clinicians plus consumers, we really can be positive agents of change in our healthcare system. We know all the wicked problems are out there. You guys confront them every day in your jobs. But if we can use these tools for creativity and for thinking differently and for, I guess, approaching a problem through a different light, then I think we've got a real chance for making significant and impactful change. And I wish you the best on your journey as a change maker in healthcare. And please feel free to reach out to me or my colleagues if you want any further information, if you want some, bounce some ideas around about how you might run a design thinking workshop in your own organization, or if you want to just follow up about, oh, hang on, I wasn't really sure what you meant by this activity, that empathy map that Natalie talked about. What does it actually mean? Just drop us an email or look at all the resources on our QUT Design Lab website and on Clinical Excellence Queensland. There's a lot out there. Have fun.